Hello, and welcome to another episode of the Med School Minutes podcast, where we discuss what it takes to attend and successfully complete a medical program. This show is brought to you by St. James School of Medicine. Here is your host, Kaushik Gua.
Hello, and welcome to another episode of Med School Minutes, where we talk about everything MD with a focus on international students, specifically Caribbean students. Today we have a very special guest, Dr. Beau Hightower. Dr. Beau Hightower is a chiropractic and Naprapathic doctor in New Mexico, and he has a flourishing practice. I would go out on a limb and say that he is the chiropractor to the stars. He's taken time out of his busy schedule. He's actually a student at our program right now, and he gave us some time so we get to see how his program's going, what he thinks about the school, and generally some pointers about how to create a successful business practice in medicine. Welcome, Dr. Hightower. Thank you so much for taking the time out of your busy schedule. I have already introduced you to our audience, but if you would like to give us a little bit about your background, that'll be fantastic.
Okay, a little about my background. I'm from Albuquerque, New Mexico. Born and raised here. I played college football. I have 6 college degrees, so I have bachelor's degrees in anatomy, biology, health and wellness, master's degree in exercise science, and then a doctorate in Naprapathic medicine and a doctorate in chiropractic. And now I'm pursuing my 3rd doctorate degree or my 7th overall college degree. So kind of a nerd.
That in and of itself is such an achievement. And I think, if you personify the word nerd, then I think everybody needs to be a nerd. Yeah. You're in sports, you're obviously great at it. And then you've just basically branched out into helping other sports people. So you're, and you have an extremely successful practice already.
Yeah, I've had my practice in Albuquerque. It's called Alito SM. We've been open for about 10 years now in New Mexico, and we have 3 locations in New Mexico. We have a Las Vegas branch, and we have one in Miami as well.
Okay, wow. And what do you actually do in that practice? It's obviously a medical practice, but what do you really do in that practice?
Yes.
What fields are you focusing on?
We have an integrated practice, so we treat primarily musculoskeletal pain.
Okay.
Mostly athletes and people wanting to be active. And we employ physical therapists, napropaths, massage therapists.
Okay.
So an assortment of integrative different health fields.
Okay.
And basically, I train them all how to treat, and we teach them our systems. And once they get going, they get a treatment room, and they're out there taking care of people and just trying to make people's lives better.
So, Dr. Hightower, I noticed that in your qualifications, you have a degree in Napropathy, and you mentioned that you've actually hired several Napropathic practitioners in your current practice. What is Napropathy?
So Napropathy, it's basically a profession that looks at the human body, particularly the fascia, and basically what we do is we take a look at the soft tissues and try to heal musculoskeletal pain by doing hands-on therapy.
Okay. So what would be the difference between that versus a massage therapist?
So massage therapy, the LMTs are typically associate level educated or maybe even lower in some states.
Okay.
Napropathy, we're taking them, it would be almost like taking a massage therapist and then educating them to a doctorate level, where they have pathophysiology, diagnostic ability to order x-rays, MR. So they're really filling kind of a gap between chiropractors and physical therapists in the pain management space.
Okay. Wow, that's really interesting. And so you also have, a degree in chiropractic. So how does the knowledge of having Napropathy along with chiropractic, how does that really help you? And then now that you're going into an MD, how do you think that these 3, not distinct, but it almost feels like they're in the same continuum. How does that help you with your knowledge base, and how does that help you with your patient care?
So, when I started in my practice, my very first practice, I worked in a family practice clinic. So I worked under two primary care doctors, Dr. Romanelli and Dr. Prasad, fantastic physicians, internal medicine, family medicine. That really opened my eyes a lot to the things that MDs could really do, not only just taking care of families and things like that, but also in the pain space. So as my practice has grown, I've run into some limitations. And in the last few years, regenerative medicine has been something that's really come to the forefront, stem cells, PRP and things like that. And I actually had some of that done on myself in Colombia and had fantastic results from it. And I realized that's something that I really want probably to integrate into my practice.
Okay.
So, I do have an advantage over a lot of the other students in the fact that I've taken, the generality of most of these classes before. Chiropractic, get to pass 4 national board exams. Naprapathy, get to pass national board exams as well.
Oh, wow.
But I have to say that it's medical school. It's the level of depth and detail, particularly in the internal segments, is so much harder and so much more in depth than I've done in any of the other programs. Like, holy cow.
Well,
St. James is no joke, man. It is. It is tough.
Well, I think that's across the board with any MD across the board, or DO even for that matter.
Sure.
I mean, because we kind of follow a program that is handed down by the World Federation of Medical Education, and our accreditors come in, and while you're in school, you'll probably see them a couple of times. They come in and they ensure that we are actually following a defined curriculum, and we're just not teaching whatever we feel like and handing out an MD at the end of it. So,
and I think I was a little overconfident coming in, and obviously in chiro school, like, there's a lot more focus on bones and muscles and ligaments, and we go over the internal organs, but you guys are training physicians and surgeons, and so the level of detail that you need to know about arteries and veins and lymph nodes and the embryological origins of all these things, I mean, it's just to a completely different level than I was expecting, I think. So
okay.
It's a fun challenge, though.
But as far as your, one thing we really talked about your qualifications, but you also mentioned that you were a sportsman when you were in college.
Yes.
And if you don't mind, could we really focus on your background a little bit, because it's so intriguing? Because I want to know what really led you to get into this field. You were obviously played sports at a relatively high level. Compared to most people. So what drove this passion for medicine for you? Like, you are going to, once you finish your MD and once you get into get into residency, you will probably be by far one of the most qualified and well-rounded physicians out there. So, I'm pretty confident you will be, but I just want to kind of understand what's driving you. Like, if take us back a little bit to your younger days.
So I think in high school, playing football and things like that, I grew up watching all the NFL guys, and I would see these TV shots, and like the 49ers in the 80s, they had a team chiropractor, and Emmitt Smith would talk about that, and Joe Montana would talk about that, and the 85 Bears and all these guys. And so I would have some back or like growing pain issues, and my family had a chiropractor, and they would take me, and he would work on me, and go in and out. My hips would feel better. So fast forward in college, I'm a biology major. I've just always been interested in science, and finishing up. At the time, I'd never really had a lot of medical experiences, so it wasn't something that had intrigued me as far as going into medicine. But I had chiropractic experiences. And that job seemed cool. My chiropractor played a lot of golf. He went to my school, so he obviously made a decent amount of money. And I was like, wow, that seems like a really cool, way to, you can physically help people. And I'm somebody that likes to lift weights and things. And so I started pursuing that. And I think I graduated chiropractic school at 26, I think.
Okay.
So then, I started working with MMA fighters, and I've been blessed to work with about 18 UFC champions now.
Oh, wow.
All of our offices are actually MMA related. And I've been able to work with Olympic athletes, NFL players, NBA players, pro boxers, across the board. So it's been a really cool lifestyle job as well. I get front row seats at these fights, or, VIP tickets.
That's awesome.
So from a former athlete, now getting to be around like high level athletics, I really couldn't have asked for a better first career, I suppose.
Okay. And, I reckon, just based on our interactions with you, that if there is anything called the chiropractor to the stars, that would probably be you.
Yeah, people say that.
So, can you give us some experiences? This is a non-medicine related question, really. It's more for my curiosity. Who's been the most interesting, famous person that you've come across?
Well, famous people are interesting in general.
Really? Why do you say that?
Well, there's a lot of different reasons to that.
Mm-hmm.
One, it's hard to live a normal life when you're famous.
Okay.
Even I deal with it to a certain extent. Like if I go to Chick-fil-A, they recognize me in the drive-thru, or I can't go to the gym at certain times because people know me from social media, and I'm just slightly internet famous. If you're at somebody's level of like these rappers or actors or things like that, I mean, I think it becomes you're very walled off. You're very cautious because people are trying to use you. Fans are trying to get into your house, and so you have to really be able to navigate and develop trust with them and know that you're not trying to like secretly take pictures of them, and that like I said, they can trust you. And so they're all very interesting in their own way.
Right.
I've been able to work with some folks, musicians, but you have to, just like you do with your patients, you have to be able to find the commonalities with them and then be able to relate to them and make sure that you're seeing them as a person and not as some star or something like that, because that's how everybody else sees them.
Okay. That's actually really good advice, because especially for a lot of our students, as they go into practice medicine, some of them actually end up seeing some unexpectedly famous people, and they're like, wait, I this is crazy. I'm dealing, and that time, I don't know, but for somebody like you probably would know exactly what to do. But I know a lot of our students have said that when they had some famous people come in, they were starstruck for a brief period. And then, but that's, again, for a doctor, that's reaction time, right?
Sure. So once you've done it before, but I would say, hey, treat them like you would every single other person. That's a human, and they need medical care, and that's one of the big things. And just be normal. Like, I know that's not instinctual for us because you're like, wow, this guy I've seen on TV or whatever.
Right.
But so they just want people around them that are going to treat them normally.
Oh, so that's exactly what my next question was. Do they really like being treated normally, or do they actually want to be put on a pedestal that the typical media puts them on?
I think they want to in certain parts of their lives, but in their professional life, they don't. They want to be, I'll say this, maybe they want to be, they don't want to wait. They don't want to, they want to come in when they want to come in. They want those perks, but other than that, they want to be treated,
Okay. So for example, if, you saw a particular celebrity and said that, oh, wow, your diagnosis is not good. Do you think that they take it personally, that when you give them a not so good diagnosis versus like an average person? Like an average person, we expect a very objective answer from a doctor. But
sure.
If you go and see if it's a famous person, are they expecting extra time to be spent with them through a diagnosis? Are they expecting special perks just because they're famous when they come to see you? Are these still factors in your practice when you meet all these famous people?
Yeah, I think that there's a lot of concierge doctors, particularly in like Beverly Hills, that they are paid a high amount and they will go to those people's houses and spend X amount of time. A lot of them have their own private physicians even.
Wow.
Generally speaking, when it's in my practice, like we might work around the schedule on the edges for them, but generally speaking, we're gonna do things the right way and the way our practice does it. And if they don't like it, maybe it's not a good fit, but at the end of the day, they'll respect you more for that.
Oh, wow. That's a very good insight. So we talked a little bit about your background. We talked a little about different forms of different studies of medicine. And what we really haven't talked about so far is the fact that you have actually built an extremely successful business. You said you have 5 practices. Why don't you tell us a little bit about your business? If you don't mind my asking, how much revenue is your practice currently making?
I think so. We don't do any insurance, so we're cash only.
Okay.
So we probably gross, between the practices, 1.5 to 2 million.
Okay.
Just on regular revenue from patient care.
Right. So this is obviously a multi-million-dollar practice. You already have 5, you said, and as far as how do you run 5 practices staying in New Mexico, and then now you're also doing this whole MD? how do you split yourself? Do you have a clone somewhere?
Yeah,
So
I'm busy. We'll just say that because I still do payroll and HR and
okay,
inventory and all those things too. So 5 is probably the max, is what I've realized. We
okay,
have 15 or 16 providers right now
okay.
that I've trained up. Yeah, and it's about, if we grow any bigger, we're gonna have to build an infrastructure like a big company. So
Okay.
uh,
And is that on the cards? Is like once you finish your MD, or do you plan to come back and probably take this to the next level?
it might be. It might be.
Okay.
We'll see. I go back and forth because I did all this and I honed my craft because I really enjoy patient care.
Okay.
Unfortunately, due to the internet stuff, I've really had to taper that back because we've had some experiences that you never would expect in
Right.
school. Fans and stalkery kind of people.
Oh,
So,
wow.
that's pushed me more into managerial and executive role. So I go back and forth because I could do the executive role, but I really, really enjoy patient interactions and making a difference in people's lives. And you know,
Okay.
I'm not sure. Maybe we do that. Maybe we continue to expand it. Maybe we add more integrative medicine into it. Yeah, I'm not exactly sure.
Okay. But
All
but
things
how
are on the.
But how do you build a practice of that scale? I mean, it's not easy. I mean, because I know for a lot of our very successful graduates who are actually physicians, they're working for
Mhm.
hospitals, and I get this question a lot. How do you build a practice? Because the practice has a significant business portion.
Sure.
Being a great provider or being a great practitioner of medicine doesn't necessarily you know mean that you're going to have a very successful practice,
Hmm.
right? And how do you marry those two together, that because you have all these medical related qualifications, but then running a business is completely different. My background is actually in business, and I've run several businesses as well, but I feel like those two are so mutually exclusive. Being able to provide a craft or provide patient care versus actually running, making sure you have the IT stuff, making sure the HR stuff, making sure the general operations, making sure the finance, making sure the marketing. How do you manage all that? And obviously, from a marketing standpoint, you're obviously a genius. You have a massive following in across your social media platform, in the millions, if I'm not mistaken,
Hmm.
across all platforms. So, how did you gain that knowledge? Because that's a question we always get from our residents. I get it actually from even our faculty members who are our preceptors in Chicago and West Virginia and Texas. They keep asking us, I want to go out and I want to do my own thing, but I'm so scared. What
Hmm.
would you say to people like that?
The old saying, "Scared money don't make money." Um, the thing is we're always selling, right? You're always
Mhm.
selling yourself. I mean, life is sales. So even when you're dealing with a patient, right, and you need to tell them something, like, say you suspect something serious is going on, you don't want to scare them and panic them into running out and getting imaging they don't need, but you also need to be able to communicate in a way where they understand it's serious, where they don't put it off. And threading that needle is not easy. It takes practice. So what I would say is, make sure you keep your overhead low. I mean, that's what we did when we started our practice. We never took a loan for anything. We bought things as we could afford them. And we leaned on our patient referrals. I mean, we asked for referrals. It's rippling. So if you do a great job and you treat somebody like you would treat your mother, and they feel like you really care about them and you're doing everything you can to make their life better, they're going to send you people. And they'll send you 3 people, and those people will send you 3 people. And then, we live in an age where you can use social media to, show your success stories everywhere. And people want to be around success and people want to do what works. And so when other people see what works, or they see that, say, a professional athlete is going here or whatever else, they go, hey, if professional athletes are spending their money to go to this place, it must be worth their time. So it's super easy. You don't have to spend money on yellow pages or billboards anymore. You've got Facebook, Instagram, TikTok, all these social media platforms. And if you can kind of learn the algorithms, which to me is not much different than learning patient patterns and learning how to interact with people. It's breaking everything down into if this, then this, if this, then this. and keeping track of what works and what doesn't, and acknowledging when things don't work. So if you're spending money on marketing over here and it's not working, or you're trying to make posts go viral and it's not working, say, okay, maybe this is not for me. Maybe I need to reevaluate how we market ourselves in this way. And like I said, to me, it's not that much different than treating a shoulder. Like, hey, I worked on these muscles. We did these stretches. They didn't work. Okay. Instead of blaming the patient or blaming myself, maybe this is the wrong intervention. So let's change gears.
Okay.
And if you do that and you're consistent and you treat people the way you would want to be treated, and you treat people like you'd want your mother to be treated, you're going to have a busy practice as long as you're doing a good job.
Okay. So Dr. Hightower, can you tell us, how did you go ahead actually building the practice? You were talking about marketing, and from what it sounds like, that sounds like a full-time job in and of itself.
Well, I don't have kids,
okay.
So the business has sort of been my baby, I suppose. So it definitely takes your time, learning how to do things the right way, paying attention to analytics and seeing what drives attention, that drives traffic, and those kind of things as well.
Okay.
So yeah, I'm not sure that goes hand in hand with medicine or healthcare. So maybe I'm a little different when it comes to that kind of stuff. But like I said, in today's internet, with TikTok and Facebook and YouTube and Twitter and everything like that, and doctors have been really going viral on TikTok. I've been seeing there's ample opportunity to be able to like get your name out there, and even like YouTube celebrities like Dr. Mike is doing boxing matches now. I see he's a DO who built a huge medical YouTube channel and probably makes millions a year off his YouTube channel. And he's an internal medicine doctor.
Oh, wow.
So there's just like, there's so many opportunities. People are looking for expertise. I think the pandemic really brought that out when people were looking for answers, and, a lot of physicians were online, kind of the ones that were giving the right answers, at least.
Right.
We're giving answers and realizing that they have this opportunity in these platforms to educate the public. And of course, as we know, doctor means it's a teacher, right?
Right.
A little different than physician, but we, really what you're doing, just like you are in primary care, is teaching people how to take care of themselves. And people appreciate that. And if you can do that, you'll get attention and people will come to you.
Okay. So, I just kind of wonder, like, how did you crack this code of getting more than 24 hours in a day, aside from the sounds of it? It's just crazy. It's like so many different facets. This is just so intriguing. So now let's move to your MD. What drove you, or what do you want to get out of your MD? Because it sounds like with all your connections, you already have an established business practice. Your MD can potentially just add a layer after your residency. You can just add a layer to your existing business practice. But what is your goals, hopes, and dreams with your MD? Why did you even think? Because most people at the point where you're at, they wouldn't even think about a career change. But there's obviously something that
right.
I wouldn't even call it a career change. You're probably going more in depth into what you already started. And what is driving that? That's what we really like to know.
So like I said, I didn't really have a personal interest in, I had never gone to physical therapy. Really, I've been to an optometrist and a chiropractor and a dentist as a kid. So I didn't really go to the doctor very much. But working, like I said, in primary care a little bit really opened my eyes. Now I work, in concert with some orthopedic surgeons, PMR docs, people like that. And like I said, I've kind of run into the max that I can get out of my field after, a little over a decade in the field. And the things, if I'm going to stay in this particular specialty, which I may or may not, we'll see. I'm looking at that regenerative medicine. I'm looking at those kind of things. For me, I'm obviously a dork. I like school. I like to take tests, honestly, always have. I think it's fun. And I'm a non-traditional student, so most of my undergrad is a little older. And so that, and my age, as the gray hairs will show you, is I'm a non-traditional student. And so, someplace like St. James that, has really taken a lot of people on their second careers really appealed to me. I've known a few people who have graduated that have matched into internal medicine, who've gone to sports medicine as well. So it just seemed like a really good fit. It's the only school I ever applied to. I got in, and now I'm in here taking tests and kicking butt.
That's awesome. And, so keeping all that in mind, since you did bring about non-traditional students, we actually have a lot of student athletes, so to speak. We actually have a 4-time Olympian also. She's in Anguilla as well. So I know right now you're doing the courses online, but when you go to the island next semester, you'll probably meet her. And then we also have a powerlifter, the world champion powerlifter, actually in St. Vincent. And then we have so many students in different realms. Not everybody is at the top of their field, like two students that I mentioned, because it's not easy to marry, a full-time studying schedule with, a schedule to practice. And you know this better than anybody else because you were in sports as well. But I think you would fit in like a glove. It will be perfect for you. How are you preparing for your visit to the island?
We're going down soon.
Okay. How are you planning your business, like around? Because I know that you're not really shutting down or anything. You're still continuing to run it. What are there any special steps that you took in anticipation of this trip?
We're not there yet. I mean, so we're delegating some responsibilities, obviously. And like I said, as of now, optimally, what I'd like to do is come back into that practice eventually, in 4 years or something like that. And in the in-between times, if there's gap years or whatever else, in obviously even just for weeks at a time to come over and just check on everything, but just not really seeing patients in my normal practice. We're trying to figure that out. It's a play by ear thing. A business is often predicated upon you being there. And so we're trying to figure out, who we could put in place that can manage things and to make sure that both the customers are happy and the staff is happy and they feel like they're being appreciated and paid well enough. And so the answer is, I don't know yet.
Okay.
We're still figuring it out as we go. I don't ever think I have all the answers, and, the answers will usually show themselves to you. And
I think that's a wonderful approach to things. I mean, making sure things, not taking things too seriously or overthinking things. I think that's the secret to it, right? I mean, we'll play it by ear as the situation comes around. You'll figure something out. As far as your personal excitement is concerned, are you excited about going to the island?
Oh, absolutely.
Okay.
I did my internship in chiropractic school. I lived in Bogota, Colombia.
Yes, you mentioned that.
Uh-huh. Yeah, so I've had the opportunity to be living in another country before, and it was actually really enjoyable. Just kind of switching things up from the rat race that we kind of do here in America. Now by the end of that, I'm ready to get back into it again, but. I think there's a lot to be said. I really enjoyed that time, and it gave me a lot of perspective.
Okay.
And I know students that have come from the island that are in residency now, they look fondly back on that time as something that was a switch up that gave them perspective on how people live in other parts of the world, and even gave them some appreciation for some of the niceties that we have. But then, of course, they miss the weather.
Right. Right. I mean, Chicago weather, at least, it's already
Chicago
pretty cold.
winters.
It's already. I mean, we've already had sub-zero temperatures here. But again, thank you so much, Dr. Hightower. We really appreciate your time. And you've given us excellent insight. I have a feeling after this particular podcast, you're probably going to get a lot of questions, especially from some of our alumni, as well as some of our preceptors about how to run a business. Because the way you've managed your schedules between your family, work, multiple degrees, and now school. And actually, it's not just even one business. You literally have 5 businesses. And just managing all that, it's truly been eye-opening and revealing for us. And all the best for you on the island. I'm sure you're going to enjoy it. And, as you know, if there's anything we can ever do to make your life more comfortable or easier, you know how to reach out to us. And we'd love to oblige.
Thank you so much for tuning into our show. We hope you enjoyed another episode of Med School Minutes. If you like our content, please follow us and receive notification when a new show is posted. This podcast is brought to you by St. James School of Medicine. For a video version of this podcast, please check us out on sjsm.org/video.